All right, go ahead, Sam.
Welcome to our teletherapy versus in-home ABA therapy debate. First, let's meet the teams. I'm Samantha, and I'll act as today's moderator and tele-introducer. Danielle will act as today's tele-summarizer. Michelle will act as today's tele-researcher. Allie will be today's tele-fielder. For the in-home side, we have Jessie as the in-home summarizer, Kelsey as the in-home introducer and researcher, and Kendall as the in-home fielder. Sorry. Now to go over some ground rules. Okay. Hi, I'm Samantha. So the rules of today's debate are as follows. Introducers will have 2 minutes each. There are 2 teams, tele and in-home. The summarizers will have a total of 10 minutes to explain their main points. Researchers will have a total of 6 minutes each to explain their research and limitations. Fielders will have 3 minutes each to answer any questions. And the moderator will sound a bell. That sounds like this, to let everyone know that they have 60 seconds left. Lastly, all team members must respect everyone in the groups. Before we begin the debate of the types of different ABA therapy, allow me to explain what ABA is, who provides therapy and what they do, and what populations are served. Behavior analysis is the scientific study of behavior, while applied behavior analysis, or ABA, is the application of principles of learning and motivation from behavior analysis. In other words, ABA is the process of systematically applying interventions based on the principles of learning theory to improve socially significant behaviors to a meaningful degree. Now, socially significant behaviors include reading, academics, social skills, communication, and adaptive living skills. These skills encompass things like fine motor and gross motor skills, as well as toileting, dressing, and work skills. Board Certified Behavior Analysts, or BCBAs, are certified by the Behavior Analyst Certification Board to provide such ABA services. To give you a better idea of what behavior analysts do, the following is the top 10 task list from our textbook. Behavior analysts will define the behavior objectively in observable and measurable terms, set up the data collection system, gather enough baseline data to determine the seriousness of the problem, graph the data to determine if there is a pattern, conduct a functional analysis to determine the controlling variables, use the results of the functional assessment and observations to then develop a treatment plan. And then they will identify the mediators, which will typically be a parent or teacher, and train them to implement the treatment plan. Develop the treatment plan, make sure it works, and train others. And finally, behavior analysts will collect data throughout this process and evaluate the results. Overall, behavior analysts' main goal is to enhance their clients' social and functional living skills. Over the past 40 years, several thousand published research studies have documented the effectiveness of ABA in the work of behavior analysis across a wide range of settings, behaviors, and populations. One main population behavior analysts serve are children with autism spectrum disorder, or ASD. 1 in 68 children will be diagnosed with autism spectrum disorder. Currently, more than 3.5 million Americans live with ASD. As you can see from this map, due to low ratio of the BCBAs per 1,000 residents, many U.S. residents are lacking services and appropriate access. The fact that most states have less than 4 BCBAs, so all of the green, yellow, purple, and red states have less than 4 BCBAs per the 100,000 residents available for the residents, in combination with technological advances, gave birth to the new age of teletherapy. One second. Okay, so teletherapy integrates the technology and allows behavior analysts to, sorry, I'm trying to find my slide here of the video. Excuse me. Tele-ABA integrates ABA and technology to allow behavior analysis to virtually provide ABA therapy services to those who may not otherwise have such services available from in-home versions. Now I will share a video clip that explains this a little bit in more depth. If I can get to screen share again.
Good morning, Winslow. How are you today?
Good morning, Mrs. Jones.
Okay, last time I saw you, we were working on the sound. Do you remember? Okay, let's get started. What do you drink out of?
At Advanced Medical, we ensure you have the career you need today and the one you want tomorrow. Teletherapy is an exciting new career option that enables therapists and patients to work together remotely from any location. Advanced medical therapists meet with students in school settings through our online platform. In each session, students practice their goals using customized game sets and activities tailored for their specific needs. As a qualified advanced medical therapist, each session is directed by you. We'll customize the tools and resources you need to provide services in a way you may not have thought possible. Start your tomorrow career today with Advanced Medical.
So as you can see in the video, it's ABA services just provided virtually, and you can do that in the home or in schools. So now we will hear from Kelsey introducing in-home therapy.
So much like the name implies, in-home therapy is ABA therapy services provided in person in the child's natural environment. So we have a short video clip to show you of a example session of an in-home therapy.
Okay. Say ba. Nice. Good working. Say da. Okay. Yeah. Say ha. Nice. Say da. Okay. That's a T sound. Is that what we're gonna get? Yes. Go. Ma. Do this. No, let's try again. Do this. Something different. Clap or no. Do a high probability. Do this. Let's try again. Do this.
Okay.
So like you can see in the video, a lot of times with in-home therapy sessions, professionals from different backgrounds, such as speech or OT, may be present, so that that allows for collaboration amongst the professionals in one area.
And now we will be hearing from Danielle and Jesse.
So we're going to talk about the main points that we would like to discuss within this debate. And the first one is going to be location. So Danielle and I will talk about the pros and cons. I will talk about in-home therapy, and Danielle will talk about teletherapy. So for location, the pros of having in-home therapy allows for families that may have busy schedules and that can't necessarily take the time to go and drop off their kid at a clinic that might be out of reach in some cases, as well as don't have the time to come pick them up with their schedules and work. This allows, in-home kind of allows the person, the therapist, to come directly into their home and adjust to their schedule. Danielle?
Well, teletherapy even extends farther beyond that. There are many people who don't live in an urban area. If you take a look at our maps, first of all, you'll see the state of South Dakota. There are only 4 centers in the state of South Dakota, and those are all within a close radius of one another. And all of the other people who live in the state would not have access to those centers. They live as far away as about 6.5 hours. If you look at the state of Illinois, you'll see a great cluster of centers. They're around the Chicago area, but surrounding areas have much less access to ABA centers, and Arizona proves as well the same point. And we as behavior analysts believe in the right to effective therapy. So teletherapy offers therapy for children who would not otherwise get it in an effective way.
Next, we're going to go into talking about parent training. Some of the pros of parent training with in-home therapy include allowing parents who are being trained how to implement an intervention can gain immediate direct feedback on how they're doing and what they can do better, or if they need to add something or not. Also, in-person feedback and discussion goes along with the ethics code 2.03 for consultation. With in-home therapy, usually towards the end or at the beginning, there is that debrief moment where parents and the therapist can sit down and they can talk about the strengths and weaknesses that the child may have and how the interventions are going, as well as feedback for the implementation and as well as scheduling for their meetings and appointments. Danielle.
Okay. Teletherapy is also a great tool for teaching parents and having consultation with them. Oftentimes, as teletherapy happens within the home, the parents can wear an earpiece in which the therapist can talk to them directly and train them as they are interacting with the child right in the moment. Parents can quickly and easily talk to supervisors or to BCBAs, and even at times when it might not necessarily be convenient otherwise, in evenings and other times. And Tele-ABA also follows the code 2.03A.
Perfect. Next, we're going to move on is our next main point is effectiveness. So some of the pros of in-home therapy allows for behavioral analysts to be there in person to observe within the natural environment, as well as try to see what antecedents and consequences are in play when the behavior is presented. This also ties along with the ethics code 2.09 treatment efficacy. So therefore they can once again provide that direct feedback and make sure that each treatment and intervention is being ran with fidelity. Danielle.
Thanks. In-home therapy is great, but it also has a greater potential for ethical dilemmas and violations. One example of this is in the ethical code 1.06. There is a risk of dual relationship in that it's possible if someone's there for them to be given gifts or invitations to come to things. And so we just avoid that entirely with teletherapy. Those won't occur. The other piece about effectiveness is that teletherapy becomes very effective in that with the equipment there isn't as much of a chance for reactivity. Usually when equipment is placed in a home or a school, there is a time where the children or adults will adjust to it, and even before it's used. And so by the time that it comes on and is used, there is no reactivity to the equipment there. and it becomes very effective for the supervisor or BCBA to watch what is going on.
Next, we are going to talk about the costs. One of the main pros about in-home therapy is that in comparison to teletherapy, the initial cost is lesser than teletherapy. Danielle.
Okay. Well, it's true that the initial cost of buying equipment for teletherapy is more. So in an interview with Dr. Aaron Fisher, who is an associate professor at the University of Utah, who does research in the areas of teletherapy and ABA, he talked about the specific concern about it costing more. And in his interview, he reflected that the cost to buy the equipment to do tele-ABA is around $800. And when he figured it out, it was about the same price as the gas would be to send someone out to a client that is far away. And so although it is more expensive right up front, that equipment will last for many years. And so it becomes a much more cost-effective way to reach those in rural areas.
Awesome. Thank you, Danielle. And our last topic of discussion will be technology. So in-home therapy, when it comes to technology, the therapists are usually the ones that are provided with the technology that'll be usually ran or used for running an intervention. Therefore, the family doesn't necessarily need to worry about expenses when it comes to that technology. Also, tele-ABA might be difficult for the learner, those who are going to be trained on the interventions, as well as the technologies that come along with it. This entails that the learner to be trained on all technological equipment systems that will be used. Also, tele-ABA may not be as consistent as in-home therapy. We all understand when it comes to technology malfunctions. So sometimes those do occur, and therefore that could affect an intervention or feedback within that moment. And as well as teletherapy may not have a good technological background. And back to you, Danielle.
All right, thanks. So teletherapy is easily HIPAA compliant with the equipment that is used, and so it follows compliance code 2.11a. It also is very much technologically savvy. It's easy to use. Also in the interview with Dr. Fisher, he talked about his experiences in his research that he has done and said that all of the equipment was very easy to use. The programs that they used, he's not had an incident of someone having a hard time using it. And the other thing is he pointed out was that those who do not have access to the internet and those services do not sign up for the tele-ABA service. And so it becomes a non-issue with the internet. His other point is that the internet and services networks, they are all growing. They're not getting smaller. And so teleservices are a way of really helping ABA become accessible to those who are in need.
All right, great. Thanks, Danielle and Michelle, or Danielle and Jesse, excuse me. Michelle will now present the research and limitations of teletherapy.
All right. In a study we found conducted by M.R. Schoenberg, research showed that client gains could be made through the use of teletherapy. When comparing those rates of improvement, study participants who had received intervention via teletherapy made an overall gain of 58%, and those who received intervention via in-home method improved by 72%. So these results indicated that both groups had made significant improvements. However, in order to make the same amount of gain, a client potentially using teletherapy method may have to have additional therapy sessions. Given that teletherapy can offer clients and their families greater continuity of care, increased access, and lower travel time, summation of these benefits seem to relate to increased convenience. Because the therapy was not always live, patients could also have therapy sessions at the time that worked best for them. Keep in mind, though, that this study was conducted on individuals undergoing cognitive rehabilitation therapy, but not ABA therapy. The teletherapy sessions were recorded and then watched, as opposed to being live, where immediate that could be provided. In another study entitled Viability and Effectiveness of Teletherapy for Preschool Children with Special Needs, conducted by A. McCullough in 2001, reported that teletherapy was easy to set up and showed high parent satisfaction with this form of ABA therapy. Positive changes in communication skills were noted by therapists at the conclusion of the study. Parents did comment that they felt more involved in the therapeutic process while utilizing teletherapy for their child. However, specific results on the participant or child improvement was not recorded in this study. Additionally, Ingersoll and Berger in 2015 published their findings related to parent engagement in telehealth specific to parents with children with ASD. They noted that teletherapy provided therapy to people who might not have been able to access alternative therapeutic treatment due to their place of residence. Ingersoll and Berger found that parents who lived in rural or medically underserved areas were able to obtain effective treatment for their children that they would not otherwise be able to give. The telehealth service was able to be given to these families at a significantly reduced cost. Participating families were often very satisfied with the care they received as a result of these services. So overall improvements in family life were noted, but something to take into consideration was that those who chose to participate in this particular study were families who had college degrees. So another area for study might be to see how families with lower SES would participate. Like was mentioned in an interview we did with Dr. Fisher from the University of Utah in May 2017, he had indicated that prices for both the in-home and teletherapy are initially the same cost. But again, over time, teletherapy equipment can be reused. For example, the cost of a Loop tabletop robot is about $800. Then it's about $300 for the tablet. Dr. Fisher said that they did a cost analysis of the average price of doing remote supervision for a year, and it ended up being around $800. So if the investment was made, a supervisor had the tools they needed to do the remote supervision for the duration of their career. In 1 year, the robot then usually paid for itself. Dr. Fisher mentioned that parents who did not have access to technology, such as the internet, typically didn't sign up for teletherapy. Thus, there continues to be an underserved portion of people. According to Heitzman and Powell in 2013, autism diagnosis in children are on the rise, creating a greater need for intervention. And if you look at the visual from the CDC website that's going to come up, you can see that the trend of autism diagnosis are on the rise. Now, due to this increase, there's been a difficulty reaching all parents to train them who live in certain rural areas of the country. Since the cost to travel can be high for parents in remote areas, parents learning how to implement themselves can reduce that cost. Heitzman and Powell found that since ABA can be an expensive treatment to sustain, parents in remote areas where access to ABA therapy is limited drive parents to really want to learn how to conduct ABA therapy themselves. In this study, due to the often large and varying amounts of caregivers in children's lives, the study only utilized 2 caregivers, and there were technological issues during the study with the Polycom equipment that is used to conduct the teletherapy session. In the Tay, McCarty, and Stoa in 2015 study, it indicated that there was no statistically significant difference in outcomes when comparing in-home to teletherapy intervention groups at the 25-week mark. Telepsychiatrists and therapists also indicated comparable improvements in global functioning at the end of treatment. Caregivers in both conditions indicated that their children improved during the trial, and caregivers in both conditions reported comparable outcomes for their children's ADH-related behaviors and functioning. But caregivers in their teletherapy group did not report improvement in their own distress. The telehealth was delivered on high-function equipment, though, which not all people have access to. Overall, there was limited research that we find with regards to teletherapy specifically related to the field of ABA, and we feel that Compliance Code 2.09 treatment and intervention efficacy would factor into this treatment delivery method due to the lack of research.
Thanks, Michelle. Kelsey will now present the research and limitations of in-home therapy.
In a study conducted by Johnson in 2012, the research presented that the behavior change was allowed in the child's natural environment because you are in their home, as well as the behavior change in the natural environment. You have the parents present, and they are a part of the programming. And because they are present, they are there and able to prioritize their child's goals to their treatment plan. The programming of in-home therapy is developed by an ABA agency rather than the parents themselves, and therapy sessions are able to be conducted in any room of the house. So this research point relates back to teletherapy and the technical aspect of it, and the possible limitations with that coming through with the technical aspect, with Wi-Fi and in those rural areas if internet capability is limited. In another study conducted in 2010 and 2011 by Gale, Eichseth, and Rudrud, their research presented that there was strong evidence in favor of running an FBA in the child's home while the parents were present. They gave examples to the parents on how to monitor treatment fidelity in home. So as the therapists are not present, the parents were able to implement the treatment with fidelity. Another aspect in their research presented that the feedback was able to be given to parents during those face-to-face meetings. Like Jessie had mentioned, you are able to give that immediate feedback because you are present in their home. A limitation to this study was that even though they monitor the treatment fidelity, when you aren't there, you're not able to determine if data was taken correctly by the parents. So this could be the cause of their fluctuating results that they found. In relation to ethics, this presents as Ethics Code 1.01, reliance on scientific knowledge. So as our research suggests, there is strong evidence as in-home being a evidence-based treatment, but we need to consider the research on teletherapy and if it is extensive enough to refer to it as an evidence-based treatment. Because as a profession, we rely heavily on this knowledge when we make scientific and professional judgments. Furthermore, a study in 2013 by McPhillamy and Dillenberger showed research on a study of 15 families who received ABA services in their home. The services were developed and mastered by the families. The parents were highly satisfied with the effects of their ABA services. Now, one limitation to this study was the small sample size. So we have to consider that there were only 15 families in this study, and the families were in one specific area. Another study conducted in 2006 by Reed, Osborne, and Cornish showed the effectiveness of ABA on the intensity levels. So they took high intensity ABA with 30 to 40 hours per week and compared it with low intensity ABA services. So, anywhere from like 5 to 15. These interventions were proven effective, and they generalized from the clinical setting, and they were replicated into the home-based setting. A limitation that we should keep in mind when we consider this study was that the effectiveness of ABA was only shown through the number of hours that the client received per week. In a final study that we found, it was conducted by Grindle, Kovshoff, Hastings, and Remington in 2008. It showed the parent experiences of home-based ABA programs for young children with autism. 100% of parents stated that their child's language and communication skills improved. Additionally, there was 66% of mothers and 72% of fathers who reported that they experienced feelings of delight when their child met or exceeded their goals because they are present in home, so they're sharing those accomplishments with their children. More than half of parents thought in-home ABA was the right choice for their child and family. A couple limitations to this study was that parents reported having difficulty with their local education authority, especially when it came to funding for the ABA services. Also, an overwhelming majority of parents said had difficulties with therapists, their presence in the home. So going back to the Tele side, this might be a limitation. Lower percentages were also presented because of difficulties with siblings. We have a table here pulled directly from that last article showing the impact of ABA on family relationships. At the top, the title is Impact of EIBI. The EIBI stands for Early Intensive Behavioral Intervention, but they are referring to ABA services. So the parents were questioned on a variety of topics and categories, and the percentages are shown of mothers and fathers who reported to agreeing with that category. And one aspect that I like to point out, which I thought was really important, considering the in-home therapy, was that 52% of mothers and 65% of fathers reported that the sibling-child relationship improved. And this is really important to consider because in families where there are multiple siblings or children, and one presents with a disability, they may tend to get more attention than the mainstream child. So the fact that the sibling-child relationship improved is a strong point for our in-home ABA therapy services.
I think her sound's not working, so I'll introduce. So, Kendall, if you want to go ahead and ask.
Is teletherapy actually more cost effective? Isn't the equipment expensive to purchase and to set up?
I'm going to respond yes to both of the questions. As Danielle and Michelle both touched on, teletherapy does have a high initial cost, but if it is used for an extended period of time, the costs do average out to be less expensive than the cost of in-person therapy.
What are the primary advantages of teletherapy?
Teletherapy allows individuals who live in areas far from companies that do provide in-home therapy to receive the services that they need. If you think of the maps that were shown earlier, there are a lot of people who don't have access to services that are required. So teletherapy can actually be used to provide those direct services or to train parents on program protocols. In addition, there's no travel required, and using teletherapy can enjoy the benefits of therapy from their own homes, while the therapist can provide assistance from an office or center. So that also cuts out the cost of just traveling back and forth.
If it works as well as in-home therapy, why isn't it used all the time?
Teletherapy is relatively new, and more research needs to be conducted to determine its effectiveness. In addition, in-home therapy is a very strong evidence-based intervention that should still be utilized when possible. You've seen the amount of research that has been presented in this debate in regards to ABA therapy that is taken in home. And then we've mentioned that there is limited research for the teletherapy side, specifically with ABA. Compliance Code 2.09 indicates responsibility to use evidence-based treatments. And many research articles mentioned in this debate were based on teletherapy as a whole due to the lack of research specifically with ABA.
Are there ethical issues involved with teletherapy?
Yes, there absolutely are. Ethical issues can be involved with any topic or decision. However, because teletherapy would utilize evidence-based treatment, or ABA, just through a different medium, which would be through telecommunication as opposed to in-home, the process is still ethical. If the parents were trained in a way that was not evidence-based, or if the treatment used was not supported by the literature, then it would be unethical. However, like any implementation of treatment, teletherapy is vulnerable to unethical decision-making on the professional's part. This vulnerability has to do with the people using teletherapy, not teletherapy itself. These issues can arise with in-home therapy as well. Code 2.09 states the importance of treatment efficacy, and although teletherapy has research demonstrating effectiveness for other therapies, there's not much research showing effectiveness for teletherapy with ABA specifically. Because everything is transferred virtually, there's also a higher potential for a breach of confidentiality, despite the fact that the equipment is HIPAA compliant. And so if that information were to get spread through sending an email to the wrong person, that would code 2.06, which protects confidentiality. I will ask Kendall questions. What are the primary advantages of in-home therapy?
In-home therapy provides face-to-face ABA therapy in the client's home. It also allows for parents to be trained in the natural environment and allows for the therapist to provide direct face-to-face feedback to the parents on their child's programming. In-home therapy sessions can be held in the natural environment, and that allows for the client's skills to be generalized within the natural environment. Since the therapist is in the natural environment with the client, it allows for more immediate reinforcement to be provided.
What are some of the cost issues that come with in-home therapy?
Certain states do not have the budget for ABA therapy, which requires families to bill their insurance companies for services. If families have to bill their insurance companies, they will only cover behavior-based interventions. Certain insurance companies will make you pay for services out of pocket or a specific fee until the deductible is met. This requires families to pay a large sum of money before services get covered. A total of 29 states in the US require ABA services to be covered by insurances.
Are there ethical issues involved with in-home therapy?
Just like teletherapy, there are ethical issues involving in-home therapy. In-home therapy uses evidence-based interventions and treatments, meaning that all the interventions and programs are backed by data. Due to the fact that you are going into people's homes and are involved with the client's family, as a professional, you come into many ethical dilemmas. There are issues with families offering their therapist dinner and gifts. Johnson 2012 states that the following questions are the most frequently asked ethical questions by parents. They are, I keep offering my therapist a meal and they keep refusing. Why are they being so rude? Can our ABA therapist and I be friends? Can I ask my ABA therapist to babysit under the table? All of these questions go against the BACB Code of Ethics Code 1.06. Code 1.06 states that due to potentially harmful effects of multiple relationships, behavior analysts should avoid multiple relationships. Behavior analysts do not accept gifts from or give any gifts to clients because this constitutes a multiple relationship. This includes accepting meals from families. Behavior analysts must also recognize and inform clients about the harmful effects of multiple relationships. Multiple relationships includes babysitting for the clients and being friends with the client's family. The relationship between the family and the child's therapist is to be strictly professional. Johnson 2012 states, when a therapist comes into your house, they will be polite, cheerful, and respectful.
All right. Thanks, everyone. Let's just wrap up this debate. Can everybody hear me, by the way?
Mm-hmm.
Okay, mic is going all crazy.
Yes.
Let's wrap up this debate with a little bit of the key takeaways. So both forms of tele and in-home provide ABA services. Both train parents and improve clients' overall quality of life. It should also be noted that each form of ABA discussed raises their own set of ethical concerns. For in-home therapy, the family has direct in-person access to a behavior analyst. It tends to be more cost-effective for families in the short term because there's no required equipment. And in-home therapy allows the behavior analyst to provide immediate direct reinforcement and feedback, which is crucial to learning. As far as teletherapy, now areas without access to behavior analysts have access as long as they have internet connection. Additionally, tele tends to be more cost-effective in the long run for families and for companies. However, it takes longer to see the results than in-home therapy. Tele-ABA therapy can be conducted anywhere. It's a huge benefit. Overall, in-home ABA therapy is best when available, but teletherapy is a great resource for those in rural areas. Thanks for watching.